Hip impingement and hip labral tears are common causes of hip and groin pain and are often the result of repetitive use from crouching sports or trauma. Today, we are visiting Eau Claire, Wisconsin. Dr. Carlson, a partner with Chippewa Valley Orthopedics and Sports Medicine, is in the forefront of using a newer procedure called hip arthroscopy, which allows minimally invasive access to a joint and treatments to problems never addressed before. Using hip arthroscopy, Dr. Carlson is able to repair tissue without dislocating the hip and without replacing it.
Hip arthroscopy is where a surgeon takes a camera on the end of a long wand, which we call a scope, and through a small poke hole incision in your skin, delivers that scope into a joint. In this particular case, we're talking about hip arthroscopy, where that scope would be put in the hip joint. The hip joint first has to be dislocated or the ball and socket pulled apart. When that's pulled apart, we can access the joint and look around and do the work we're talking about doing. Once inside the joint, through other portals, we call them, those poke holes that we use to access the joint, we can use other instruments, again on the end of a long wand, to perform the work inside the joint. Things like repairing the cartilage rim of the socket, called a labrum, fixing cartilage defects or problems on the head of the ball or the lining of the socket, repairing tissue around the hip, such as ligaments or capsule, repairing tendons that attach to the hip, or releasing them if need be, depending on the particular problem.
Dr. Carlson's goal is to eliminate the segment of untreated patients or patients with delayed treatment who have curable hip pathology, educating potential patients and their providers that these symptoms are not things they need to live with or that they are not from their back or groin pulls or early arthritis. Few orthopedic surgeons are operating on hips through a scope because it is a newer and technically difficult surgery. Therefore, certain diagnoses may be missed by physicians not familiar with these newer treatment options.
Patients I see with hip joint pain that can be fixed and not just replaced can range from their mid-teens or younger teens to 50, 60 years old. In the past, patients who had labral tears in their hip were told that they may have some pre-arthritis or an early arthritic problem. They may be told that they were just prone to frequent groin pulls in the sport of their choice. And taking some time away from their sport, they may sometimes be able to return to the sport with just continued pain. And fortunately now, with our knowledge of the concept of labral tears and our ability to treat that problem, we can take people who are otherwise just waiting 20 years to undergo a hip replacement, or just feeling that they can't ever participate in that activity because they'll just keep getting groin pulls. We can take that person, we can make them better, we can fix their problem, we can bring them back to their sport, and allow them to continue to develop as an athlete or as a worker or whatever particular activity they're trying to do where that hip is affecting them.
Chippewa Valley Orthopedics and Sports Medicine has been committed to the healthcare needs of patients in western Wisconsin for over 45 years. Their success and reputation as an outstanding orthopedic clinic can be attributed to the teamwork of their friendly, knowledgeable physicians and staff.
Here at Chippewa Valley Orthopedics and Sports Medicine, we have 12 partners: orthopedics, neurosurgery, non-operative spine, and foot and ankle. We really pride ourselves in listening closely to the patients and hearing what they're saying, spending a lot of time engaging in the conversation of what is really bothering that person.
After meeting with the patient, Dr. Carlson determined that his difficulties had all been related to painful hip impingement.
It was incredibly important for me to meet with a doctor that understood sports and athletics and kind of just how I wanted to continue that lifestyle instead of just kind of shutting it down. So meeting with someone like Dr. Carlson was incredibly important to me because he understood how I still wanted to be active after a surgery and still wanted to maintain my daily lifestyle.
While visiting with Dr. Carlson, we learned that he grew up skiing and continues to ski competitively across the country and also enjoys hunting, fishing, and hiking. He is passionate that his patients' goals are his goals. Whether it is getting them back to playing with their kids, working aggressively, or competing in sports, his patients are more active and enjoy their lives.
When I see those people so happy with themselves, so happy with their decision to have this fixed or to go through this process, as scary as it sometimes is, if you don't know what's on the other side, it's so satisfying for me.